For more, Grover Norquist, Americans for Tax Reform founder and president. And Grover, that really gets the headlines, the 24 million or however many million that are left uninsured versus Obamacare. As a result of this plan, do you see it as a blow for House Speaker Paul Ryan, the White House, and everyone else backing the plan?
No, the Democrats will try and play that, but they missed the key issue. What the CBO was asked to score was, does this increase the deficit or not? If it doesn't increase the deficit, getting rid of Obamacare and beginning to reform health care, then the legislation that Paul Ryan and President Trump have put forward can be passed with 50 votes in the Senate, plus the vice president, and a simple majority in the House. And their answer was yes. And not only that, it's a $300 billion reduction in deficit spending, which means those House Republicans that think it's not conservative enough, and some senators, you can now take $300 billion in reduced deficits and cut other taxes in order to earn support that wasn't there. There's a lot of wiggle room that didn't exist before the CBO. On the question of their guessing what happens in 10 years on who would buy insurance, if you read their text, they make it very clear. They don't know. They're making predictions on what state legislatures do. That's not a bunch of experts. That's a bunch of guessers. And what they told us 6 years ago was that today there'd be 24 million Americans who had insurance than do today. So they were off by 24 million in 6 years, and they want us to believe make-believe numbers in 10 or 20, and they don't count the dramatic expansion of health savings accounts, which are in the bill. I mean, this is a dramatic reform. It's not just cutting taxes and so on. It block grants Medicaid, just as we block granted aid to families with dependent children under Clinton. All the experts misunderstood how well that worked. They make the same mistakes about block granting Medicaid that the hard left made about block granting aid to families with dependent children welfare. It's understandable. Haven't really done much of this, but we have seen them make this mistake before.
So there's the reaction, Grover, and I take your point about this potentially being able to win over some Republicans that were worried that this was just Obamacare 2.0, a massive new entitlement. But what about those like Senator Tom Cotton from Arkansas, states that have really benefited from the Medicaid expansion and are worried about the impact this is going to have on Republicans in the 2018 midterms?
Well, I think one of the most important things you can look at is how successful Bill Clinton's block granting of welfare was. There was an effort then to say go Google, Clinton welfare reform quotations, and you will get all the same people, Robert Reich and so on, who are now attacking block granting Medicaid, said the exact same things about block granting welfare. And it turns out they were 180 degrees wrong on welfare. It's very clear why. What we had was, under Medicaid, top-down, one rule, 50 states, everyone lives under the same rule. With 50 different states taking 50 different approaches on welfare and states can do everything to require a work requirement for Medicaid. If you have single men, a lot of whom get Medicaid, you can say you got to work for it. You got to have a job. You got to be trying to get a job. There are a lot of ways that you can reduce the costs as it goes out to the states. And states found they actually had money left over after welfare reform was block granted. So the block grant is a very powerful tool to get real people who need real help. In Maine, what they've done even now, before this reform, is they've said able-bodied people got to work, and they've been able to target the elderly and the indigent with Medicaid dollars. Now all 50 states could begin to make those decisions to target the people that really need it.
Mr. Norquist, this bill would roll back the tax increases on people who earn more than $200,000, both on their income and as well the addition to capital gains. There are those who simply say what it really represents is a transfer of income and benefits from middle and working class to the richest Americans, and that really is the main thrust of the bill. How do you respond to that kind of criticism?
Well, we heard that when Obama put these taxes in. Remember, he promised us he wouldn't raise taxes on anyone who earned less than $250,000 a year. 30 million Americans with flex accounts pay Obamacare taxes to fund Obamacare. That's gone. 20 million Americans have health savings accounts that are taxed by Obamacare. That tax is gone. That's 30 million Americans. 10 million Americans who have very high costs of health care and low incomes, so that more than 10% of their income is eaten up by taxes. It used to be at 7.5% you could expense it. Obama took that away from the poorest, sickest Americans and said, no, got to be 10%. 10 million Americans, poorest, sickest people in the country, are screwed by Obamacare with tax increases. That Obama tax is gone. So you can selectively say, oh, there were some taxes on rich people. That's why politicians do that. They have a couple taxes on high-income people so they can go after everyone else. They tax medical devices. If you have a medical device, you pay higher taxes. They tax insurance. Your insurance costs more.
Yeah.
That doesn't reduce your costs. They tax charitable hospitals. These are the Obama taxes that are being gotten rid of. So it is a tremendous help to lower and middle-income Americans. And the Obama people have tried to not talk about how they've gouged middle-income people, and they go, look at that.
We've got to leave it there. That's certainly one side of the argument. There are a lot of people who disagree with you. But, Grover, thank you for coming on and sharing.